My name is James Anderson, Jr. I'm from Quimby, South Carolina. I had a stroke in July. I had some surgery that Friday before and I had a stroke that Saturday, Saturday afternoon after I came home from the hospital. And it just hit me all of a sudden. You know, I was there playing with my daughter in the house after I got home, and it just came down my left side.
I noticed that he was struggling to get in the chair. And I asked him, "Are you okay? Can I help you with something?" And he didn't respond. I immediately knew that something was wrong. Because I work in a healthcare facility, I determined that he'd had a stroke. We immediately called 911, got him to the hospital, and through the evaluation and assessment, we were able to determine that he did have a stroke. He was a candidate for stroke intervention at MUSC, and he was transported there.
And when I looked at a CT scan, it was clear there was no bleed. He had no contraindication for treatment for ischemic stroke, or that kind where the blood clot is blocking off the blood supply to a certain area. The decision was made, since there was no stroke already seen on a CT scan and the damage hadn't been done yet, that bringing him down for a possible intervention was probably going to be a good option for him. And luckily, you know, weather permitted, and he was able to fly down. He got here probably in an hour or two. Based on some advanced imaging that we did as soon as he got here, it was clear that the tissue had not died yet. It appeared to be viable, and he actually went for a thrombectomy, which is basically where one of the endovascular neurosurgeons can go up through the blood vessels. They put what's sort of a mini shop vac right up to the clot. They have a little poker, they kind of break it up into pieces and suck it out. And they were able to perform that thrombectomy. Within a day and a half, he had regained all function back. His right side, you know, he regained full strength and was able to talk and understand everyone.
And it's amazing that they can do this type of procedure. They went in and they removed the clot.
The people were wonderful, the healthcare was wonderful, the people working there, everybody was just great.
I will have to say this about the doctors at MUSC. They were absolutely excellent. They were awesome. The information they shared with me, the printed information the hospital gave me, I read everything. And after James got home, he read all the information as well. But I can't thank MUSC and the physicians there enough. They saved my husband's life, and they brought him back to me.
What I've learned in talking to medical people and my wife being a good caretaker, if people around somebody think, go ahead and call medical personnel. Call 911 and get them to a hospital as soon as possible. Don't wait and say, well, he may be having a stroke, he may be having this. They go lay down, they're not feeling well. Get to the nearest medical facility as soon as they possibly can.